We are back. Psoriasis is more than just a skin condition. It's a chronic disease affecting both the body and the emotional well-being of those who live with it. The journey to finding the right treatment can be long and frustrating, often marked by setbacks and feelings of isolation. Joining me now is the Board Certified Dermatologist, Dr. Omar Noor, and psoriasis patient Mark. And thank you so much, Dr. Moore and Mark, for joining us. And I'll start with you first, Dr. Noor. Tell us a little bit about psoriasis from the perspective of, as I said, many people just, labeled it as one thing, but the reality is it's a whole lot deeper.
Yeah, no, thank you for having us, Darren. And psoriasis is a very important topic because it really does affect people on multiple levels. It's an inflammatory disease that's due to an overly active immune system. And that overactive immune system produces inflammation in the skin that causes thick, silvery, scaly plaques that are itchy, uncomfortable, they flake, and they can cause a lot of emotional distress because patients will come in saying that they feel that people look at them differently. Sometimes a patient will come in and say, "Oh, I think that person thinks that my rash is contagious." And we're here to talk about, there are a lot of options and newer options to help improve their condition.
Yeah. So you have this autoimmune disease in psoriasis, but then also, as we said, the physical condition is affected, the emotional condition is affected as well. And when patients come through your door, what's the experience like for you?
It varies. Psoriasis is a full spectrum. I had a woman come in not too long ago. I'm located in the New York area, and I had a woman come in who had psoriasis. She was older, about 40 years old, had a child. Her mother had psoriasis, and she was worried if she could hold her child because she thought that she was going to give the psoriasis to her child because she felt that her mother had given her the psoriasis because she had touched her. So, every kind of scenario is different. I think the most important thing is if you feel you have psoriasis, if you have any signs, any symptoms, you want to reach out to a dermatologist. Start the discussion, start the communication. Know that we have treatment options, that there might be some miscommunication around whether it's contagious or not, and know that we can get you better.
Yeah. I want to bring Mark in on the conversation right now. And Mark, as a patient, first going through psoriasis, talk to me about the process and as you were finally diagnosed with psoriasis, what was it like in the initial phases before you actually found out you had psoriasis? What were some of the symptoms you were dealing with?
Well, and I was diagnosed with psoriasis very early in life. I was 7 years old. It was 1962. Student in school, noticed a lot of spots on my arms and didn't know what they were. Mother took me to a dermatologist and he said, "Hey, he's got psoriasis." That wasn't a real big surprise from my parents. My maternal grandfather had severe psoriasis, and we knew back then that, if you had relatives that had a history of psoriasis, then, there was a fair chance that you would get it too. What does amaze me, though, is the maybe cultural revolution isn't exactly the way to describe it, but when I was a kid, and you watch Johnny Carson or any of the late night shows, and they would talk about the heartbreak of psoriasis. Mm-hmm. And they would talk about it as if it were a joke. Oh, he's got the heartbreak of psoriasis. And people didn't understand how hard of a disease it is, how hard it is to live with psoriasis, the itching, the pain that you can get, the bleeding when they crack and bleed. Nowadays, you can't scan across the TV dial without seeing a psoriasis commercial. And so now there's a lot of top of mind awarenesses, and the treatments have gotten so advanced with biologics that even the worst cases of psoriasis, like I have had myself, they can be cleared up or almost cleared up. I just have, maybe a spot on my head and a little bit in my ears. I used to be covered 95% with psoriasis. So
Right. Well,
things have really changed.
Well, I do want to come back to you in just a second. I want to bring Dr. Noor in one more time and ask him about that, because the treatment options for those with psoriasis have changed dramatically. We heard Mark talk about, being diagnosed since 7 years old, but so much progression has been made in the area of medicine to actually deal with psoriasis. Can you speak to that?
Yeah, I mean, we're blessed to be in this age of medicine where there's just so much research going on, new advances in techniques, and even new advances in treatment options. So one of those treatment options that I've had a lot of great success with is a medication called Ilumya, which is a biologic for moderate to severe plaque psoriasis. And it offers the ability to do in-office injections because every person is different, every scenario, we do have a lot of different options. And you really want to make sure that you find a dermatologist, you talk about your journey, you as an individual, to make sure that you're being treated with the right option for you. And allowing for those in-office injections really allows for just 4 touch points a year just to see the progression that you're having with the treatment.
Yeah. And before we go, I mean, there is this stigma. I mean, I got to get out of here, and I've only got a couple seconds left, and I don't want my producer wringing my neck. But there is this stigma that's associated with psoriasis. Very quickly, if you could have a couple of words on on how to break that stigma.
You're right, there is a stigma. The stigma is a lot of patients feel hopeless, you feel uncomfortable, you feel isolated. Know that there are options. Reach out. There are so many options out there to look better, feel better, and really just reach out to your dermatologist and advocate for yourself, advocate for self-love.
Yeah.
And for more information, you can go to illumya.com/I love ya. That's ILUVYA.
Thank you so much, Dr. Noor, for being with us. Mark, for sharing a bit of your story, and certainly keep up the good work in terms of providing the resources and the awareness with regards to psoriasis. We appreciate you both being with us.
Thank you.
Thanks, Daren.
All right, thank you. Listen, now, if you want more information, go ahead and visit the website at ilumya.com/I love you. There you can find out about psoriasis. And if you notice anything about Mark and also Dr. Noor, that patient-doctor relationship makes all the difference in the world.